You know, inside your body, there's this, well, it's like a major highway, a super important one that carries blood from your entire upper body straight to your heart. So what happens when that highway gets completely, totally blocked? That's what we're going to dive into today, a condition called Superior Vena Cava syndrome.
Right. I want you to picture a major interstate, peak rush hour, and suddenly it's completely shut down. Chaos, right? A massive, gridlocked traffic jam. Well, that is pretty much exactly what happens inside the body with this condition. It creates this really dangerous backup of blood. So, here's our game plan for this explainer. First, we're going to really get a handle on this traffic jam idea. Then, we'll dig into its causes, and trust me, there are some surprises there. After that, we'll look at how doctors actually find the blockage, check out the incredible treatments that clear it, and wrap up by talking about what it all means for the future of medicine.
All right, so first up, what exactly is this venous traffic jam we're talking about? Let's get right into it.
Okay, so the Superior Vena Cava, or SVC for short, that is the critical highway we were just talking about. And when it gets obstructed, when something blocks it, blood just can't drain the way it's supposed to from your head, your neck, your arms. And that causes a really serious backup. It's a state of, well, venous congestion, and your body immediately starts scrambling to deal with it.
And you can imagine what that feels like for a person, right? The symptoms are exactly what you'd expect from all that pressure building up. We're talking about a feeling of fullness in the head and neck, actual swelling of the face, the neck, even the eyelids, plus shortness of breath, bad headaches, dizziness, and you might even see these prominent new veins showing up on the chest. That's the body desperately trying to build its own detours around the blockage.
Okay, so the big question is, what's causing this major blockage in the first place? You know, for a long time, the answer was pretty straightforward. But today, the story has a really fascinating and kind of unexpected twist.
So if you look at the breakdown of what causes it, you see the surprising split. About 60% of cases, yeah, they come from malignant or cancerous tumors. But a full 40%? They come from benign, non-cancerous causes. And what's really interesting is that 40% number is actually on the rise.
Now, in that malignant category, the main culprit has pretty much always been lung cancer. Often, it comes with something called, get ready for it, mediastinal lymphadenopathy. It's a mouthful, I know, but it basically just means swollen lymph nodes in the chest. And what happens is, a tumor, or these swollen nodes, can grow and literally just pinch that major vein shut from the outside.
But here's that twist I was talking about. The leading cause of the benign cases today, it isn't some rare, mysterious disease. No, it's a direct result of modern medicine itself. We're talking about things like indwelling central venous catheters and pacemaker wires.
And just to give you a sense of the scale here, get this. Over 5 million central venous catheters are placed in the US every single year. 5 million. And look, these devices are absolutely life-saving, no question. But they can also irritate the inside of the vein, and that can lead to the very clots and blockages that cause this whole syndrome. It's a real paradox.
Okay, so a patient comes in. Doctors suspect a blockage. What happens next? How do they confirm it's really happening and pinpoint the exact cause and, more importantly, the location?
Well, doctors have a whole toolkit at their disposal for this. I mean, it always starts with a good old-fashioned physical exam, of course, but it moves very quickly to some pretty advanced imaging. And these tools are amazing. They don't just let them see the blockage, they can also map out all those detour pathways the blood is desperately trying to create.
And out of all those options, there's one that has really become the gold standard. It's a special type of CT scan called a CTA. And the reason it's so popular is because it's fast, it's widely available, and it creates this unbelievably detailed 3D map of the whole problem. It shows them the exact location, how bad it is, and what's causing it. It's the whole shebang.
All right, now for what I think is the most exciting part. How do we clear that traffic jam? This is where a minimally invasive approach called endovascular treatment comes in, and believe me, it has completely revolutionized how this condition is handled. The procedure itself is it's remarkably elegant. So picture this. Surgeons get access to a vein, usually down in the groin, and then they navigate this tiny, flexible guide wire all the way up and right through the blockage. Once they're through, they inflate a small balloon to widen the vein, and then they deploy a self-expanding metal mesh tube that's called a stent, and it basically acts like scaffolding, propping the vein open for good. And the result? It's just incredible. I mean, there's a quote from the medical literature that really says it best. The relief from these severe, often incapacitating symptoms is almost instantaneous.
We're not talking days or weeks. The pressure in the head subsides, the swelling goes down, that awful feeling of fullness just disappears, often within a matter of hours. Just like that, the traffic jam is cleared.
But, what happens if stenting just isn't an option? For some patients, especially if the blockage is really long or complex, there's another plan. It's a more intensive route, for sure, but it's also a highly effective alternative: open surgery.
So how do you compare these two options? Think of it like this. Stenting is way less invasive, right? The recovery is much, much faster. The downside is it might need a tune-up, a follow-up procedure down the road. On the other hand, surgery, well, it's a much bigger operation, no doubt about it. But the bypass grafts they create are incredibly durable. They are built to last for the long haul.
Now here's what's truly fascinating. When you look at the data for benign cases after 3 years, the long-term success rates for both treatments, they're practically identical at keeping that vein open. We're talking 96% for both. And because that endovascular approach gets you that same fantastic result, but with less risk and a much faster recovery, well, you can see why it's become the definitive first-line treatment.
So let's zoom out. What's the big takeaway here? What does this whole journey from a total blockage to almost instant relief really tell us about where modern medicine is today?
Well, for the patient, the transformation it's nothing short of dramatic. I mean, they go from having these debilitating headaches, severe swelling in their face and neck, to almost immediate relief. All those physical signs of that venous traffic jam, they just melt away. I've got to imagine it's one of the most satisfying outcomes for both the patient and their doctor. So the key takeaway is this. Superior Vena Cava syndrome is absolutely a serious and, let's be honest, a frightening condition, but our ability to diagnose it and to treat it has improved immensely. Today's solutions are just faster, they're safer, and they're more effective than they have ever been before.
And that kind of leaves us with a really fascinating thought to chew on, doesn't it? The very medical devices we create to save lives are now a leading cause of this syndrome. It's a paradox, and it really makes you wonder, as our technology keeps getting more and more advanced, what new, completely unforeseen challenges will it create for us to solve next?